Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. Feeling unwell? Seeking expert medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic healthcare. Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital, Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, MCH and maternity.
We have labor and delivery. We also have postnatal care, and also we deal with mothers who've come that are sick and are there in the antenatal period. That is antenatal care. Generally, we admit every mother who walks in labor and any mother who comes from the clinic for monitoring of labor and also delivery services. And also in maternity, we have a theatre whereby all mothers who are not delivering normal are usually taken to theatre for cesarean section.
Ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cash.
Specialist clinics and CT scan services. Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 0797 972 794 or 0769 781 880 or 0717 305 204 or email us at info@stmarysmissionhospital.co.ke. St. Mary's Mission Hospital, Langata. Compassionate in healthcare.
A very good morning to you, dear viewer. Thank you for joining us yet again on another episode right here on Capuchin TV on our Health Corner show with me, Maureen Kimani, a program brought to you by Capuchin TV in collaboration with St. Mary's Mission Hospital. And while today we're very delighted to be at St. Mary's Mission Hospital premises as we have this conversation about Diabetes Wellness Day. And joining me, we have a guest who will be introducing themselves in just a few, just to tell us why is it important to create awareness about this diabetes. And all just to say, I think is that diabetes is more than just a medical condition. It is a daily journey that millions of individuals around the world navigate from, monitoring blood sugar levels to, having that diet, the food, the lifestyle, all about that. And so we'll be engaging in this conversation to help you understand more about diabetes and to create awareness for you. And in case you have any question to our guest today here, you can send them on 0717-424-866, or you can use our SMS number that is 21760. Welcome to the conversation. A very good morning to you.
Good morning.
How are you doing?
Very well, thank you.
It's good to be here by the St. Mary's Mission Hospital. How do you feel having Capuchin TV around? Awesome. All right, and I would love you to tell our viewers who you are and what you do here at St. Mary's Mission Hospital. Kindly introduce yourself, Dr.
Thank you, Maureen, and thank you, Capuchin TV, for having us here, St. Mary's Hospital. My name is Dr. Bernard Gitoma. I am a specialist physician. What a specialist physician means is a specialist doctor involved in the care of patients with adult medical conditions. And mainly we are talking, for instance, today about diabetes. So we're involved in the care of patients with diabetes, conditions like hypertension, asthma, cardiac diseases, and so on and so forth. And I'm happy that today you've chosen diabetes to be the topic of discussion. I think we'll be discussing it for the next few minutes or so. So thank you.
Doctor, it's good to have you here. Yes, moving on to Our Lady.
Thank you very much for this opportunity and for having us here. My name is Dorcas Obure. I'm a nutritionist, a dietitian. And it's good that you're having this topic today because of the non-communicable diseases have been on a rampart, especially in our community now. And it is good for us to bring awareness so that both young and old can know how to go around with our lives, so that in the near future we'll not have a country that is having trouble with non-communicable diseases, especially diabetes. So thank you very much for the forum.
Moving on to our last guest.
Thank you for this opportunity. My name is Dr. Austin Odhiambo. I'm the Chief Pharmacist at St. Mary's Mission Hospital. And what mainly we do, we deal with medication therapy management, because as we know, diabetics deal with a host of drugs, a concoction of drugs. So our role here is to ensure that number of drugs ensure that they meet their treatment goals and the patient are well, and we improve their standards of living and their health in totality. Yes.
Thank you very much for that first part. And of course, to you, our dear viewer, as we move on to our conversation on our second part, we shall engage with more patients who will be coming here to experience this journey and to learn more about, and we shall be getting to have a talk. So stay tuned for that. But Dr. Let's begin with the conversation. When you talk about diabetes, what does it mean being a physician?
Thank you once again. Thank you. So in simple terms, when we talk about diabetes, we are talking about a condition that we call in medical terms diabetes mellitus. So generally it's the condition which is chronic, and it's a situation where the body is not able to handle blood sugar or blood glucose, and results now in excess blood glucose in the body. And because of high blood glucose, then there are certain signs and symptoms patients will feel. But more importantly, when blood glucose is not treated, then it leads to complications or certain health conditions that could damage your body organs. The eyes, for instance, the nerves that go to your legs, including your heart, which is key, the kidneys, virtually every organ in our body can get affected by diabetes. So in simplified terms is the body's inability to control blood glucose, which emanates from the foods that we eat. Whatever food that we eat gets converted into blood sugar. And if the body is not able to produce enough insulin from the pancreas, then we result into a problem that is called diabetes mellitus. So many people think like it's a simple thing about insulin deficiency or inability to produce this hormone that controls the body's metabolism and handling of blood glucose. But it's a little more than just deficiency of insulin. There's another subset of diabetes that is known as type 2, where, yes, the patient is producing insulin, but it's not working in the sites that is supposed to be working in the body. Let's just say, for instance, the muscles or the fat cells, the insulin is not optimally working, and as a result, then the blood sugar rises. Yeah. So when
And I wanted to ask you, who is prone to this diabetes? Is it everyone, and why?
Good question. The risk factors for diabetes are well known. Majority of them really is classified now as a lifestyle disease. Lifestyle in the sense that the process of urbanization, change in diet, lack of physical activity, and of course when you have an abnormal diet or a diet that is full of calories or carbohydrate, then you are not able to handle your blood sugar. And because of that, you gain weight. With excessive weight gain, then comes the process of something we call insulin resistance, inability of the body to handle the glucose that you load into the system, and that results into diabetes. So I can list the risk factors in simple terms as a lifestyle, where you have a diet that is unhealthy, and this is a diet that is really full of starch and sugars, refined sugars, a diet that is low in fruits and vegetables, and let's say, for instance, refined soft drinks. This dietary problems is one of the major risk factors that you can tackle. The other risk factor, obviously, is genetics. How your genetic makeup is, what you're made of, how your family members have been, and your forefathers. So there's something that is termed as a genetic or inherent risk, because you will find there are patients who may have this unhealthy lifestyle and don't develop diabetes. So not all of it is really from lifestyle, but some of it is actually from genetic predisposition, what people would call hereditary. Yeah. Then the other risk factor for diabetes is physical inactivity, or really what you would call lack of exercise. So when you're sedentary or you lead a sedentary lifestyle, for instance, you leave your house, you drive to the office, you sit the entire day, and then in the evening when work is finished, you drive back to the house, you're very exhausted. So that goes on and on for a whole year. So you lack exercise, and that is what we are calling urbanization. And that's all right. As opposed, of course, to people who are in the rural community, who will have breakfast and proceed to the farm the entire day. That increases their physical activity, and of course are less prone to diabetes. And that's all right.
Dr. Ria, for that insight. And actually that brings us to the second question, that is to Dorcas, because you've been able to tackle about the nutrition part and the lifestyle. How do you think of being a nutritionist? How does that nutrition part play in this diabetic?
Thank you for the question. When it comes to nutrition, it is a wholesome aspect. We are looking at it from the time our babies will breastfeed to the time we'll mature up to adulthood. So whatever we are doing is from the starting point, and we are looking at how we are going to do. If I start from the beginning, if we do not do the exclusive breastfeeding, then definitely we are exposing our babies to other things before 6 months. So we've already started working negatively on the baby's body. When they get to toddler, that's when we start giving snacks, and at times it is unhealthy snacks. Then they get to adolescent, they can do it on their own, and if you set a bad example, then they pick it from there and they start eating junk in a big way, because now they are independent. When we start working, just like Dr. Gituma said, we are not active, we are eating junk, we do not get involved in exercises. Some of us will engage in things that are not right in terms of food. So we end up getting a generation that has issues like diabetes. So from a nutrition view, number one, I would recommend that we do exercises. That is very key. As you also observe our weight, the BMI, body mass index, is very important. That is something that we should be doing it occasionally or routinely. Then we should also check on what we are eating, because if we indulge in too much snacks or we do refined sugars, and most of us, our culture, we don't do fruits, we don't do vegetables. And if we are doing the vegetables, it is a very small amount. So we check out on those issues from when the babies are young, so that we build a culture whereby whatever we are eating is right. Remember, what you eat is what you are. So from a nutrition perspective, let us do the right thing. Yes.
But there's this debate, people say that before you eat your food, you're supposed to have your fruits. And some say after you eat your food, that's when you're supposed to have your fruits. What do you say about that?
On a normal day, people say fruits are appetizers, right? So if you're appetizing, then why should it come after food? Actually, on a normal setup, it should come an hour before you eat your food. And remember, you're just eating a small amount. We are not overindulging. But if someone is in a setup whereby they cannot get it before food, then it is allowed they can do it after food. Yes.
Thank you very much, Dorcas, for that insight. Of course, it's a valuable one. Austin, to you, when you talk about Diabetes Wellness Day, what does it mean to the viewers and to the patients? Why is it important to have this day to our patients?
Thank you for that question, because what happens with diseases like diabetes is they are filled with so many myths and misconceptions, and it's only through group learning that we can really address some of these things. When different patients come and state their experiences, they ask their questions, probably somebody else's misconceptions might be addressed. So the reason why we have this awareness is so that people can demystify what diabetes is, and so that when now they come to the pharmacy and for instance they've been given insulin, they don't look at it as a death sentence, they look at it positively. So that is what comes with such awareness days. And we can remember during the COVID-19 pandemic, diabetes was widely mentioned as one of the predisposing factors that were causing COVID-19 patients to succumb. So so the days where we address those myths and misconceptions, we give patient education, and even the patients themselves, they educate each other on this chronic disease. As you said, it's a chronic disease. Once someone is diagnosed, it's a journey that they walk with through their lives. So that is why these events are very important, and that's why we've spared time to come and really talk about this diabetes. It's not such a big deal, but if it's well managed, the quality of life is just normal. Yeah.
Thank you very much. And Tari, when you talk about diabetes, can someone have a diabetes and not know? And maybe you can explain what are some of the early signs and symptoms that people can be able to take to just pay attention to.
Okay. So to respond to your question, the answer is absolutely yes. That many people actually we see on average with type 2 diabetes, which we said is the diabetes of the older population, those that are obese, can go up to as long as 10 years. You can imagine 10 years with diabetes and you do not know if you've not gone for screening, because the symptoms are subtle, and slowly when the symptoms develop, they do not strain the body's physiologic system. So someone can have diabetes and either attribute it to other problems like chronic fatigue, or attribute it to other urinary symptoms, or attribute it to other conditions other than diabetes itself. So in this sense, we would like maybe to sensitize maybe our viewers and tell them that there are people who should get routine screening for diabetes to detect early. And when you detect diabetes early, then you can avert or prevent complications. So the people that we recommend to have screening are those with positive family history of diabetes. For instance, if you have a first-degree relative, a parent, or a sibling who has diabetes, then every so often, once every year, you need to have screening for diabetes, which is a simple test, a fasting blood sugar. Early morning before you have a meal, you go and get your blood sugar tested. And if that is absolutely normal, then you know you're going to be maybe diabetes free for the next 1 year until the next screening. Yeah, and some of the symptoms of diabetes are not only unique to diabetes, they could be attributed to, for instance, fatigue, which is one of the earliest symptoms and signs of diabetes. May not be absolutely attributed to diabetes, but other than people may feel like I have been working too hard, or I have not been getting enough sleep, and that's why I'm tired. All right? Yeah, but the other symptoms, let's say feeling thirsty, if, for instance, you live in a hot environment, or the coast, for instance, or northeastern, you may feel thirsty, but you attribute it to the weather or to not drinking enough water. And you may go on for years and years without a diagnosis. So we want to sensitize our viewers and tell them, get annual screening for diabetes. If you have a first-degree relative with diabetes, if you feel you're overweight, and if you have any of those symptoms, fatigue, feeling excessively thirsty, going to the bathroom for a short call more often than you used to previously, or getting frequent urinary or genital infections. There's an infection we call candidiasis. This is fungal infection of genital area, more common in the ladies. So if you feel that every so often you're being treated for recurrent or frequent genital infections or urinary infections, you could be having diabetes. So please proceed to the nearest facility for screening. And screening is a simple test like we've described. It can be done in the nearest health center. It can be done in a hospital setting. It can be done in even a pharmacy that is near you, so you don't have to go to a mainstream hospital. You only need treatment in a mainstream hospital that has specialists or has the team that is involved in the care of patients with diabetes. If, for instance, you need the multidisciplinary team, for instance, the nutritionist, the pharmacist, the food care specialist, or a counselor will advise you about, the emotional aspects of diabetes and so on and so forth. Yes. Yeah.
Thank you very much, Dr. for that first part. And I think we're going to release you. As you all know, we are in St. Mary's Mission Hospital. You have to go and attend to some patients. So we're going to take a very short break. But when we come back, we shall continue with this conversation on diabetes. And of course, Dorcas, you can be able to share with us how can these patients or the role of the diet plays in managing and prevention of diabetes. And of course, with Austin, you can also share about how patients should ensure that they keep on with their medication as they are prescribed by the doctor. So we're taking a very short break, but we shall be right back in just a few. And in case you still have any question to them, please make sure you send to us, and we'll be able to get back to you in just a few. Stay tuned for that.
Feeling unwell, seeking expert medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic health care. Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning, and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital, Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, MCH and maternity.
We have labor and delivery. We also have postnatal care, and also we deal with mothers who've come that are sick and are there in the antenatal periods. That is antenatal care. Generally, we admit every mother who walks in labor and any mother who comes from the clinic for monitoring of labor and also delivery services. And also in maternity, we have a theater whereby all mothers who are not delivering normal are usually taken to theater for cesarean section.
Ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cash.
Specialist clinics and CT scan services. Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 0797 972 794 or 0769 781 880 or 0717 305 204 or email us at info@stmarysmissionhospital.co.ke. St. Mary's Mission Hospital, Langata. Compassionate in healthcare.
Welcome back, dear viewer, to our conversation right here on Capuchin TV with me, Maureen Kimani, on our health program, Health Corner, right here. And today we're camping at St. Mary's Mission Hospital as we bring you conversation about diabetes. And in case you are joining us right now, we have had our first part of which we had Daktari, and he was able to explain a little bit and more about, the healthy part, and of course, what are some of the signs and symptoms that you should, pay attention to. And of course, he sensitized and emphasized on the importance of, screening part. And joining us in the second part, we have a patient from here, St. Mary's Mission Hospital, and she will be sharing about her journey and, of course, giving advices even to young people. Stay tuned for that. Welcome back. Yes, and starting with Pamela, because you are joining us now. Kindly say hi to our viewer, say who you are, and umetoka wapi.
Good morning, everyone. Thank you, Maureen, for inviting me to Capuchin TV. I stay in Langata, in the neighborhood of St. Mary's Hospital. And my diabetic journey is long, but I must say it started about 6 years ago. I realized from screening by a doctor that I had diabetes type 2. And from that time, I was managing using tablets. But along the line, I fell sick last year in May, and I was brought to St. Mary's Hospital. And it was not easy for me, but I think St. Mary's Hospital really managed my case. Diabetes had escalated. I had cerebral malaria. I had a painful sciatic nerve, and I had hypertension. But the doctors here and all the medics, they worked very hard that from May 2023 until July 2023, I was in this hospital, and then I was discharged. And even when I was discharged, I was still very weak. St. Mary's Hospital gave me a nurse who would come every day to dress my diabetic wound. So I'm forever grateful to God and also grateful to St. Mary's Hospital. Diabetes is a journey. I'm still on the journey, and I'm fighting it bravely. Yes.
Very much, Pamela, for that. And moving on to Dorcas, I can see you have something on your lab. Maybe you can be able to explain to our viewers, what do you have there? And of course, before we had gone for the break, I talked about the role of diet, that is in prevention and managing diabetic. Maybe you can be able to explain to our viewers.
A very big role when it comes to diabetes, and as I mentioned before, whatever you eat is what you are. So when we are coming to the non-communicable diseases, and more especially diabetes, we are looking at a diet that will help you either control your blood sugars or prevent you from getting the blood sugar related diseases. So with me here I have a chart. This is called diabetic plate, and most of our plates are round here. So what we recommend to the patient is that half of our plate should always be vegetables. And when we speak of vegetables, we are not only focusing on the green leafy vegetables, we are also looking at things like carrots, broccolis, courgettes. All these are in the class of vegetables. So when we tell a patient to take half of the plate to be vegetables, then we focus on the variety. Again, if you do only one type or you limit yourself, you will not be able to get all the nutrients that you need. Then on the lower part of this plate, we have two portions. One portion is starch. Remember, when you're dealing with starch, you are at risk of getting so many other non-communicable diseases and even having obesity or overweight. So when it comes to starch, you only say that you get a quarter of your plate. That means that if I'm getting, for example, ugali, it will be a fist of my hand. If I'm doing something like rice, it will be a serving spoon and a half, so that I get enough energy for the day. Remember also, energy in is energy out. So if you know you are going to eat this and just stay along in the house, or you are not going to have any exercise, then still we are in trouble. Then the other portion is proteins. Remember, in proteins we have two types. We have the plant proteins and the animal proteins. They are both very important. If you don't eat any animal protein, then you are at risk of getting vitamin B12 deficiency. And when you do not take also the plant proteins, you are in trouble because of refugees. So in this portion, we are only doing a quarter of your plate, meaning the size of the palm of your hand. If you're doing something like fish, the size of palm of your hand. If you're doing something like beans, then we are doing a serving spoon, one serving spoon of beans. Remember, beans also has some starch in it. So if you follow this plate, we are able to either prevent or control your blood sugar levels. And remember, this is not the only thing that the diabetic patient is eating. They're supposed to have breakfast, mid-morning, lunch, mid-afternoon snack. Then we have our dinner 2 hours before we sleep. The habit of eating and sleeping immediately is also a problem in our culture. The habit of eating and drinking water immediately is also a problem in our culture. The habit of us eating a big chunk of ugali because we've had a long day is also a problem in our culture. So let us watch out on what we are eating, because if you are not diabetic now and we overindulge, then you are at risk of getting diabetes. So let us all be very cautious and let our viewers know that some things are preventable, and if you have them, they are manageable. They are not a death sentence. Yes.
Have a conversation all about a nutrition part, because I think people should know and have information on what to eat, the portions. You have to control the eating habits that you have. And I think this question goes to Dr. Austin. We have someone here asking, what are the key components? Okay. How does diabetic impact other aspects of health beyond blood sugar levels?
Thank you for that question. I think Dr. Gituma brushed through it. When you have diabetes, that means you have high amounts of blood sugar that are not being utilized the right way. It can affect all your other body parts. And as Dr. Gituma mentioned, it can affect your nerves. It can affect your eyes. That means you find patients who have become blind courtesy of diabetes. It can affect your kidneys. Yeah, it makes it impossible. It makes it so hard for your wound to heal. I believe Pamela mentioned that she had to undergo almost daily dressing of her diabetic wound. So it literally goes and affects all the other systems. So it can go to your kidney, it can affect your heart, it can affect your eyes, it can affect your legs, it can affect literally everything. So if your sugar is uncontrolled, there's no limit to what it can do. Yes.
On you, Austin, we have another question here. Are there any specific lifestyle factors that can impact the effectiveness of diabetics medications?
Wow.
Tough one.
That's a tough one, but I think they've taken me back to medications, which is my field. So I think I can answer. You know, with diabetes, what we do with the drugs do two things majorly. Either they supplement insulin. That's why we have actual insulin as part of diabetes medication. So we either stimulate the secretion of insulin, we give you insulin itself to improve, or we stimulate your cells to utilize the insulin that is in the body. So with those three mechanisms, there are many drugs that are used. So many lifestyle factors, and I know most gentlemen will come and ask me, can I drink a little alcohol? So that is one lifestyle factor. For smoking, as we know, smoking affects the nerves normally, and I've also mentioned that diabetes also affects the nerves. So you're just exacerbating the problem. So smoking, drinking alcohol, there's no amount of alcohol that is safe for your body that doesn't predispose you to other ailments. So those are some of the lifestyle problems. But then now we have other issues that were also mentioned: physical inactivity, living a sedentary lifestyle. You know, because when you mention physical inactivity, doesn't necessarily mean you have to go to the gym and pay 6,500 per month. Even going up the stairs instead of using the lift, walking to work, riding your bike. So there are so many factors, and when it comes to the drugs themselves, there is a correlation between when you eat and when you take your drugs. For instance, if you're taking insulin will lower your blood glucose, so you need also to link the diet bit and the timing of your food with your medication. So as you say, that's a complex question, but the viewer can feel free to contact us for more information. Yes.
All right. And as we continue with this conversation, I hope you can be able to see what is happening on the other side. We have patients coming in to ensure that they get this conversation about diabetes Wellness Day. So in case you're just around here at St. Mary's Mission Hospital, Langata area, or even Nairobi, you can just step in here to experience this screening part of it, because it's a free, right? Yes, it's a free activity that is happening. So step here inside, and you'll get all the services and education that you need to know about. As we continue this conversation, Pamela, Dorcas has been able to talk about the nutrition part. As a diabetic patient, what do you think is the importance of taking care of your diet? Because sometimes you may step outside and you have gone to an event, and then you may take even a whole day by the time you get food. How do you ensure? Do you carry something with you, or what happens?
Thank you, Maureen. When the doctors, nutritionists, all the health workers, when they talk to us, we really have to listen to them. I do listen. And I will not let you into my bag right now, but I have carried some nuts and some water, just in case my blood sugar goes down and I go into what they call hypoglycemia, because they have taught me that hypoglycemia can even be worse than hyperglycemia. So I take care of myself. When I'm away from the medics, I am my own doctor. I try to remember what they told me, and I try to take care of myself. For example, in the morning, I took some green vegetables. Dorcas, that's what I can find easily. I took some little pieces of meat, half a cup of porridge, and I was good to come here. So the most important thing about a diabetic person, take care of yourself. Listen to what the doctor says. Listen to what the nutritionist says, and listen to your body. Okay.
All right. Thank you very much, Pamela, for that. And to you, Dorcas, sometimes you may find that these patients who are diabetic, when they come here or when they step inside here at St. Mary's Mission Hospital, they have someone who is accompanying them, especially for the elderly. But then when you direct the nutrition part they're supposed to take, when they go home, the person who brought them here is not the one taking care of them. How do you help patients like those ones?
Thank you, Maureen. Just as Pamela has mentioned, when you're diabetic, you have to be your own doctor. But it is true, when you have these elderly patients, at times it is tricky because they are not in control of their own food. They are not in control of how and when they are taking their medication. Someone else is doing it instead of them. So what we advise the caregivers is that, for example, if they're being brought in by their children and there is a caregiver, we always advise the people who are bringing her in to come along with the caregiver, the key person who is with this patient, so that we don't have a scenario whereby we are giving information to the child who is supposed to relay to the caregiver, and then the caregiver now gives the service to the patient, because by the time it gets to the caregiver, the information might be distorted. At the same time, we also give them written materials so that in case this person is not in a position to come with the patient, they are able to see the written materials. And whatever we have has also a picture of the plate that we are having here, which is somehow self-interpreted. And it also has some written materials, which if you have someone who is literate enough, they can be able to read and interpret and see what is supposed to be done. But again, they should not stick to what is written. What we should do is we use the locally available. What matters here is the portions. Because if I have vegetables and I have ugali and I have omena, that is a complete food. What I need to do is just to have the portions, little amount, and make sure that I don't miss on vegetables, and vegetables is what is much on my plate. Yes.
And I think as we wind up on our conversation today, I'm sure, Austin, you have left something to talk about as per the Diabetic Wellness Day is concerned, and the medication part of it.
Thank you. I think what we do as a pharmacist, we call ourselves the patient's advocate. And our main concern is adherence. Because you can come, Dr. Gichuma will prescribe everything, Dorcas will say everything, but then if you come to pharmacy, our role is not only to provide the drugs, but also to ensure that you adhere to the medication, you take your drugs as per the schedule without missing even a single dose. And the things that make patients to miss a dose, especially right now with our economic times, is lack of money, for instance. So we have to ensure that each patient is prescribed drugs that they can afford, and we discuss that with the patients. Another thing when it comes to drugs, the challenges that diabetics face is wrong information. During the last time we had our Diabetes and Awareness Week or Day, we had a patient who was told that whenever you start injecting insulin, you will die. And it was my role to come and tell you, no, that is not the truth. Insulin will do this, this, and this. So when it comes to medication and diabetes, we have to inform the patient that this is a lifelong journey. And you'll have to take this journey with medication, plus the diet, plus the lifestyle modifications, and all that. So what we try to do is we don't isolate medication as medication. We look at the patient as a human being, and we ensure that there are no factors that will hinder them from accessing the medication. Also at St. Mary's, we've tried as hard as possible to have all the essential medications available so that our patients can get them and at the best price. No matter when, even though we face some challenges from time to time, we try our best to ensure that our diabetic patients have access to their insulin, to their oral hypoglycemics and all that. So we've tried, and it's a journey. I believe it's a journey that we have to take as a team. It's not just the patient. It is me, you, the patient, and everyone is involved in it. Yes.
Still on you, Austin, at any given time, can a patient maybe stop taking this medication, or does it mean you'll take this medication for the rest of your life?
That's a good one, and it's also a question that patients ask. They tell us, if I am feeling better, can I stop taking the medication? And my answer is usually simple. when you started taking the medication, was it in your own volition? It was not you who decided I'll start taking the medication. It is the doctor. You came to the doctor and he or she prescribed a certain medication. So the same person who prescribed it is the only person who can tell you to stop it. Yes.
Thank you very much for that clarification. Yes, moving on to Dorcas, maybe you can do your parting shot and maybe a thing that you'd love to share to the viewers and to the patients at large who are diabetic and to young people, because we talked about like everyone is prone to diabetes. Maybe you can have a message in terms of nutrition part. Yeah.
For those who are already having diabetes, as I mentioned before, it is manageable. It is a condition. So let us set our minds positively because it is something that we can deal with. And for those of us who are not yet diabetic and we are not wishing that they get to diabetes stage, I just want to urge everyone to watch out on their diet so that we prevent ourselves of getting to diabetes. Let us watch out on what we are eating. Let us do routine checkups. Let us exercise. As Austin mentioned, it is not about going to the gym. Even walking for 10 minutes, that is exercise enough. Then let us make sure we take water. Also, let us watch out on our stress levels. At times, these things also contribute to us having issues that we cannot control. But above all, what you eat is what you are.
Thank you very much for that beautiful, valuable insight from you, Dorcas, and your parting shot. Now to you, Pamela, as we wind up to our conversation. What is that message you'd love to share to your fellow maybe patients who are, suffering or having this diabetic, condition, and to younger self of you?
Thank you, Maureen. To those who have diabetes like me, I'll just say diabetes is a monster, but it's not a death sentence. It's something we can manage. We have to fight it. We will not sit down and just let it get the better of us. We have to fight it. So listen to your doctors, listen to your nutritionist, and listen to your body. What works for you? Maybe some foods will make your blood sugar spike up. Listen to what your body responds to. To the young people, yes, you are young and agile and healthy, but the best thing I can say, please go. When you hear there's screening for diabetes, for cancer, for whatever, just go. Even if you feel okay, go. Because the doctors, the people screening you might find something that can save your life instead of just sitting back and feeling, I'm not sick, I'll not go. Go and listen to them, find out how your body is, and that can save you a lot of issues because diabetes is very expensive, really, really expensive. The drugs, the food you're supposed to eat, the time you have to spend preparing the food, and also watch out for stress level. These days, I think the younger people are more stressed than we are, we the elderly. So watch out, as the nutritionist says. Otherwise, diabetes is manageable. I am managing, and you can see I'm managing. So just take the cue from the doctors. Thank you very much.
Thank you very much, Pamela, for being bold and coming out to share your story. And I'm sure you've been able to strengthen other people and giving them hope. Because as you talked about, that diabetes is manageable and they don't have to worry. Because sometimes the stigma that is around in the society, and people, when they feel they're sick, they start getting scared of that. So thank you very much. Thank you to you, Dorcas, for sharing that nutrition part. And I think we shall have a conversation whole about nutrition. So we're looking forward to that. Not forgetting Austin, thank you for making time, and I wish you the very best in your work. And of course, Dr. Ben, who was here with us in our first part, thank you very much, and may God bless you all in your work. Pamela, all the very best, and may God bless you too. Yeah, thank you very much to you, our viewer, for staying tuned to our Health Corner show right here with me, Maureen Kimani. And today we have had a good time here at St. Mary's Mission Hospital as we engage and we come together to create awareness and to educate about diabetes. So I'd love to say thank you to the team that has been behind the scene. That is Capuchin TV crew. We have Justus Okari, we have Henry, we have Alan Andiva, Kelvin and Zisa, we have Eric Otieno, and not forgetting Peter Mwangi. May God bless you. Wishing you a blessed day. See you next time.
Feeling unwell, seeking expert medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic health care. Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital, Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, MCH and maternity.
We have labor and delivery. We also have postnatal care, and also we deal with mothers who've come that are sick and are there in the antenatal periods. That is antenatal care. Generally, we admit every mother who walks in labor and any mother who comes from the clinic for monitoring of labor and also delivery services. And also in maternity, we have a theatre whereby all mothers who are not delivering normal are usually taken to theatre for cesarean section.
Ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cash.
Specialist clinics and CT scan services. Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 0797 972 794 or 0769 781 880 or 0717 305 204 or email us at info@stmarysmissionhospital.co.ke. St. Mary's Mission Hospital, Langata. Compassionate in healthcare. Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Welcome to Tangaza University College, a multicultural community of holistic formation rooted in gospel values. Our academic programs include postgraduate, undergraduate degrees, diplomas, and certificate courses. At Tangaza University College, we pride ourselves as the leading college in inclusivity, with all our learning facilities attuned to accommodate students with special needs. Delight in an ambient environment, professional lecturers, and world-class learning facilities, including a spacious, well-equipped library, a research center, science laboratories, and a multimedia studio. Our full-time and part-time intakes are open in January, May, and August every year. We also offer holiday-based programs